Hello friends, I welcome all of you to my yet another episode of Future Midwife. Still we are in the track of complications of pregnancy. Today we'll discuss with the Abruptio placenta. Abruptio placenta is otherwise known as placental abruptio. It is a pregnancy complication characterized by premature separation of placenta from the uterus. The incidence of abruptio placenta is approximately 1 in 100 pregnancies. Here we'll discuss about the causes and risk factors of abruptio placenta. The first one is hypertension. High blood pressure can cause the placenta to separate from the uterus. Second one is trauma. Physical trauma such as car accident or fall can cause the placenta to separate. The third one is smoking. Smoking during pregnancy can increase the risk of abruptio placenta. The fourth one is cocaine use. Cocaine use during pregnancy can increase the risk of abruptio placenta. The fifth one is multiple gestation. Women carrying twins or other multiples are at a higher risk. Sixth one is previous history. Women who have had a previous abruptio placenta are at higher risk. The last one is uterine anomalies. Women with uterine anomalies such as unicornuate uterus are at higher risk. So these are the causes and the risk factors of abruptio placenta. Next, we'll discuss about the main signs and symptoms of abruptio placenta. The main sign and symptom include vaginal bleeding. This vaginal bleeding will be bright red in color or sometimes dark clot can be occurs. Along with the vaginal bleeding, mother experience persistent uterine contraction. Then there will be back pain, uterine tenderness and fetal distress. The fetal distress will be identified by fetal bradycardia. Next is the classification of abruptio placenta. Abruptio placenta can be categorized into three ways: grade 1, grade 2 and grade 3. In case of grade 1, minimal separation of placenta with minimal vaginal bleeding and no fetal distress. In case of grade 2, moderate separation of placenta with moderate vaginal bleeding and possible fetal distress. In case of grade 3, complete separation of placenta with a severe vaginal bleeding and also we can expect severe fetal distress. So these are the three classification of abruptio placenta. Again, according to the bleeding, we can categorize the abruptio placenta into two ways. The first one is revealed abruptio placenta and the second one is concealed abruptio placenta. In case of revealed abruptio placenta, the bleeding tracks down from the site of placental separation and which is drained into the cervix. So here we can see the vaginal bleeding. Whereas in case of concealed abruptio placenta, the bleeding is remain within the uterus, especially form a retroplacental clot. Here we cannot see the vaginal bleeding, but it can cause systemic shock. Depending upon the separation of placenta, we can categorize it into three ways. The first one is marginal separation. Here we can see the vaginal bleeding. The second one is partial separation of placenta with the vaginal bleeding. The last one is complete separation of placenta with concealed hemorrhage. Next, we'll see the diagnosis of abruptio placenta. The first one is physical assessment. In the physical assessment, we can see vaginal bleeding in case of revealed separation. So, in case of concealed separation, we cannot identify the vaginal bleeding. In both cases, mother experienced severe uterine contraction. Next, we can go for some blood test, especially CBC, coagulation profile and platelet. In order to confirm the diagnosis, we can go for ultrasound. In case of ultrasound, we can identify the site of separation and the fetal well-being. Here we reach the management aspect of abruptio placenta. First one is initial assessment. In that, evaluate maternal vital sign. which include we have to monitor the blood pressure, pulse, respiration and oxygen saturation. The second one is assess fetal well-being. Monitor fetal heart rate and perform a biophysical profile if necessary. The third one is determine the severity of bleeding. Assess the amount and duration of vaginal bleeding. Next one is stabilization. In that, first management is administer oxygen. Provide oxygen therapy to maintain adequate oxygenation. The second one is fluid resuscitation. Administer intravenous fluid, especially RL, to replace lost blood volume. Third one is blood transfusion. Administer blood transfusion as needed to maintain adequate hemoglobin level. The fourth one is pain management. Here we can provide pain relief with analgesics or anesthetics as needed. Next is the expectant management. Manage conservatively if the mother is stable, the fetus is not in distress and the bleeding is minimal. Then we can go for delivery. Deliver the fetus if the mother is unstable, the fetus is in distress or the bleeding is severe. The surgical management includes cesarean section. Perform a cesarean section if the mother has a history of uterine surgery, the fetus is in breech position or the mother has a multiple gestation. Apart from that, if the mother have any maternal hemorrhage or shock present. Usually the cesarean section we prefer once the conservative management fails. Next is the postpartum management. In that, first one is monitor for hemorrhage. Monitor for postpartum hemorrhage and manage accordingly. The second one is monitor for infection. Monitor for sign of infection and manage accordingly. The last one is provide emotional support. Provide emotional support to the mother and her family. So these are the management of abruptio placenta. The complications and prevention will be displayed on the slide. Please have a look on it. So here we can wind up our today's topic, abruptio placenta. I hope all of you understood about the abruptio placenta. So in the next class, we will meet with another episode of midwifery topic. Till that, take care. Bye bye.